afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Today we will have 3 people speaking on behalf of the province. The province's Chief Medical Officer, Dr. Jennifer Russell, Health Minister, the Honourable Hugh Fleming, and Premier Blaine Higgs.
We will have 3 speakers joining us, and they are as follows. Dr. Jennifer Russell, the Provincial Chief Medical Officer of Health, the Honourable Hugh Fleming, Minister of Health, and the Honourable Blaine Higgs, Premier of New Brunswick. On va commencer
We will begin with Dr. Russell.
with Dr. Russell.
Good afternoon, everyone. There are 3 new confirmed cases of COVID-19 in New Brunswick, and this brings our total number of cases to date to 111. The new cases confirmed today are all in Zone 3, the Fredericton region, and are all contacts of previously known cases. And they are an individual under the age of 10, an individual aged 30 to 39, and an individual aged 40 to 49. The number of COVID-19 cases in New Brunswick continues to rise, but slowly. This is a testament to the early actions taken by the province to restrict public movement. More importantly, it is due to the actions that each of you are taking every day to slow the spread of the virus. Aujourd'hui, j'annonce qu'il y a 3 nouveaux cas confirmés.
There are 3 new confirmed cases of COVID-19 in New Brunswick. This brings our total number of cases to date to 111. The new cases confirmed today are all in Zone 3, the Fredericton region. They are all contacts of previously known cases. They are as follow: an individual under the age of 10, an individual aged 30 to 39, and an individual aged 40 to 49. The number of COVID-19 cases in New Brunswick continues to rise, but slowly. This is a testament to the early actions taken by the province to restrict public movement. More importantly, it is due to the actions that each of you are taking every day to slow the spread of this virus.
My message to you today is simple. Keep doing what you are doing. Continue to stay home, in your home, as much as you possibly can. Continue to keep your interactions brief when you go out and maintain 6 feet of physical distance from one another. Continue to wash your hands regularly and thoroughly. Keep doing these things every day. We have asked that everyone put off their Easter celebrations and other rites of spring this weekend. I appreciate the sacrifice that this entails. But we cannot afford to let up even for a moment. This is a stressful time, so continue to be good to yourselves, take care of yourself first, get plenty of rest, and avoid information overload. Nous avons demandé à tous de
We have asked that everyone put off their Easter celebration and other rites of spring this weekend. I appreciate the sacrifice that this entails, but we cannot afford to let up, even for a moment. This is a stressful time, so continue to be good to yourselves. Take care of yourselves first, get plenty of rest, and avoid information overload.
Treat yourself with the kindness you would like to receive from others, but don't give the COVID-19 virus any breaks. And when I'm talking to the population at large about being kind, everybody is experiencing the stresses of COVID-19 differently. But make no mistake, every single person in this province is experiencing stress right now related to COVID-19, and that's why it's especially important for us to be kind to one another right now. And by being kind, I'm also talking about protecting people's privacy. So I have said a few times now about what the process is for public health in terms of the investigation of each and every case. And each and every case is investigated by my public health teams exactly the same way. So we diagnose a case, we contact the close contacts immediately, and if there's an exposure within an institution or a work environment, we let that business or that organization know. If there's a public exposure, I will be telling you at the 2:30 briefings, or it would be released in a press release. So you would always have that information that is publicly necessary for you to know, or if you are closely connected to a contact. So in terms of being kind, I'm asking you to not post things on social media, whoever you are in the province. If it's not related to you personally, it's not helpful in terms of the work that my public health teams do in each region. So you might want to be doing something that's transparent or something that you think is helpful, but it can actually be counterproductive to the work that public health is doing. So please respect confidentiality. And that is what I'm asking you when I'm asking you to be kind as well. So what happens next depends on each and every one of us. We have the power to continue to slow the spread of the virus, and it is up to each of us to continue to use that power. And I do want to encourage people to look after their mental health, their physical health, etc. Please contact your family doctors who are doing virtual care right now. I know there's some walk-in clinics that are doing virtual care. If you need help, reach out. And I really urge you to do that, especially in this time that is so stressful for everyone. And I thank you very much. Merci.
Good afternoon. How this outbreak unfolds is in large measure in the hands of New Brunswickers. We can change the outcome by how we conduct ourselves, by staying at home, physically distancing, and practicing prevention. As you've heard me say before, this pandemic will be defeated outside of the hospitals, not inside, and it will be defeated by prevention, not by cure, because there is no cure at this time. Recognizing that we get new information on a daily basis, we have set forth some modeling that we have as to what the situation may look like. We've seen that done in other jurisdictions, and it is appropriate that we communicate that same degree of information to New Brunswickers, as they have equal amounts of concern as anyone in any other jurisdiction. It's clear from our data that our public health measures so far have made a difference. The closing of schools, there have been no public health measures. The modeling shows that we could have seen 5,600 deaths in New Brunswick. 5,600 New Brunswickers could die during the course of the COVID-19 pandemic if we did not and do not and had not taken any public health measures. And when I say the full course of the pandemic, I'm referring to the time of the first case until the time that a vaccine is found, which could be in the 12 to 24 month period. And until a vaccination is found, it is very difficult, if not impossible, to achieve herd immunity, which is what we ultimately need. Public health measures like social distancing, good hand hygiene, staying at home, self-isolation, and complying with the state of emergency order that the government has done to the letter If we do that, we can win. If we don't, we put ourselves, our friends, and our loved ones at risk. As forecasted by UNB earlier, you can see that New Brunswick is on the same path as South Korea, and that's good news. And that, again, is because of the aggressive public health measures taken early and the position that your government has taken, which is to prepare for the worst, hope and pray for the best. It is clear that partial measures don't work, delay doesn't work, and the virus thrives in both. Half measures and time is of the essence. We need to realize that. We acted quickly, and the results that we're seeing today shows some glimmer of hope and success in that regard. You'll also see that there could be within 550 to 1,750 deaths over the 12 to 2,400 period, even with social distancing. I hope it's less, and we need to challenge and implore all New Brunswickers to drive that number down as far as we can drive it. And that's what we need to do. Again, we prepare for the worst, and we hope and pray for the best. At the end of the month, we could see up to 13 cases in an intensive care unit on April 30th. These are intensive care units available in our health authorities. The number is based upon a projection of the number of cases in ICU since first infection. That's the good case, the best case. Should we not continue with our discipline, the worst case could be upwards of 84 patients in intensive care units. And providing all New Brunswickers comply, we are projecting up to 28 acute COVID-19 care hospitalizations on April 30th. Again, this project is based upon New Brunswick's being compliant. The worst case scenario is we could see up to 194 acute COVID care hospitalizations on our busiest day. Should we reach the worst case scenario, I want you to know, and I want New Brunswickers to know, that because of the planning and the social distancing measures we have taken, the system has the bed capacity to handle the worst case situation. And according to our current modeling, no one will be without a bed and no one will be denied. Again, this can change if we don't remain vigilant. We need all New Brunswickers to help us continue to change the outcome. It's very important that I stress this. We're doing well so far. When you look at the numbers, the people of New Brunswick, by conducting themselves in the appropriate preventative manner, have produced measurable and definable results. Our public health measures and early indications are clear that we have made a difference. Let's not get complacent, but we have made a difference. When we look at other provinces, we look at the Canadian numbers, North American and world numbers, New Brunswick's early discipline has made a difference. So what I need to stress to people today, stay at home, stop the spread, and stay safe. As New Brunswickers comply with these public health measures, I can tell you what we're doing on a daily basis to be more and more prepared as this unfolds. We are securing personal protective equipment to protect our healthcare workforce and ensure infection prevention controls are in place in New Brunswick for our health system and our long-term care institutions. New Brunswick was better positioned than many jurisdictions in this regard, with satisfactory inventories in this way. I am comfortable in that we must be vigilant, we must continue to work on our supply chain, but we do have sufficient personal protective equipment to handle the situation. We are aggressively pursuing capacity and technology for mass testings. We have ramped the Dumont lab up to the potential for handling 1,000 tests a day. The GenX technology for testing in 7 of our regional hospitals is being implemented. We have a very good supply of reagents and test kits. And right now, again, I'm feeling okay about the testing. Can't be complacent. We're working hard on enhancing and growing the supply chain and the reserves, but right now, we do not have a crisis, and we are testing everyone that needs to be tested. We are further enhancing our capacity for contact tracing to respond any potential clusters or outbreaks that may unexpectedly occur so that we can test, surround, trace, isolate, and exterminate should this rear its ugly head in a manner that we are not expecting. Remember, if we get lax, especially over this coming Easter weekend, these numbers could be out the window. We could easily have 100 more cases of COVID-19 in our province. I've spent the last 65 years spending Easter Sunday and Easter dinner with my family, and I'm not going to do that this year because it would be a selfish act to do so, and we must continue on our present course. I'll close with making an analogy to Dr. Dow. It's a hockey analogy when he spoke here on Tuesday, and he referred to a hockey game. So I'm going to refer to the same type of thing. What we're providing New Brunswickers with today is data which is kind of analogous to the end of the first period. But the game is not over at the end of the first period. And if you're winning 3-1 at the end of the first period, it doesn't mean you're going to win the game 9-3. We're not popping champagne bottles or getting fitted for championship rings or anything else like that. We're being vigilant. We're keeping our stick on the ice and our eye on the puck. So if we continue doing what we're doing, I feel that New Brunswickers can meet this challenge successfully and at the lowest amount of human cost. And if we get lax, it can snap and bite us very quickly. So that's the situation with respect to modeling. I'm cautiously optimistic, and we need to stay the course. Thank you.
Good afternoon. Bonjour. 5,600. The projected number of New Brunswickers that could have died over the course of this pandemic if no public health measures had been taken. 550 to 1,750. the projected number of New Brunswickers that could die over the course of this pandemic with public health measures, depending on the level of compliance. To put those numbers in perspective, 1,800 New Brunswickers died in the Second World War. Je suis un homme qui aime la...
I am a man who loves numbers. But to be honest, these numbers make me think a lot because they're not just numbers.
Aren't just figures on a graph. These are people. These are New Brunswickers. And I want to do everything in my power to make sure that we keep those numbers as low as possible. In fact, I want to do much better than the best case projection that we've seen today. And I believe that together we have the ability to do just that.
Together, we are already taking the necessary measures so that the best case scenario becomes a reality. Together, we are doing much more than just flattening the curve.
We began by taking swift action, and we are continuing to make progress by following the directives of public health. Thanks to those steps, we look at New Brunswick in relation to other countries, we can see they were not following the same path as Spain and Italy, where there's been tragic loss of life and the public healthcare system has been overwhelmed. Notre cheminement raison plus.
We are following a path similar to that of South Korea. It is a country that has acted swiftly and in a decisive manner to limit the spread of this virus and to limit loss of lives.
Even then, the projected base scenario for New Brunswick by the end of April is 512 confirmed cases, 5 patients in intensive care, 28 patients in acute care, and 15 deaths. It's easy to look at these numbers and to get overwhelmed. It is understandable if these numbers make you feel scared. I urge you to not give in to fear because you have the power to make the difference. There is indeed hope. And where there's hope, there's confidence. And where there's confidence, there's results.
These numbers are projections based on today's data and also based on our capacity to follow public health's directives.
Today, we have 111 cases of COVID-19 in the province, of which 53 have recovered. The 3 new cases that are reported today are all in one family, all in this area, resulting from one member traveling to Ontario over a week ago. Now, I don't make this statement to be critical. I make this statement for people to understand how easy it is for our numbers to explode, and also how easy it is to make a decision that, well, I won't get infected. It won't happen to me. But as we have seen all throughout our country, all throughout other countries, it can happen to anyone. It can expand rapidly. And as the minister said, as Dr. Russell has said, this could be a changing weekend. This could be a game changer this weekend. If we continue to follow the rules closely, we can be a game changer in New Brunswick. We can have the curve flattened before it ever rises. And how exciting and what a confidence builder that will be as we rebuild New Brunswick. Right now, the majority of New Brunswickers are doing what public health is asking us to stay safe and be healthy. Those that are doing so, I thank you sincerely. But we must have 100% compliance. We need to be sure we can defeat this virus. We are making a difference. To those who are taking chances, putting your own life at risk, as well as the lives of those around you, you must stop. You must think about not only yourself, but your family, your parents, your grandparents, your neighbors, your friends.
Now is the time to contribute, to take the right decisions, and to save lives. The power is in your hands.
As a government, we are committed to doing everything possible to protect our citizens. Today, I've asked the Minister of Natural Resources, Mike Holland, to delay the opening of the recreational fishing and hunting season for a minimum of 2 weeks. This position will be evaluated on April 30th. I am a fisherman, and I love the outdoors, and I want to get back into that situation in the coming weeks and months, as soon as we possibly can and can do it safely. But this is no time for us to act differently than we are now. This is no time to take anything for granted. This is a time, as the minister said, stay the course. I know what this means, and I'm hopeful that conditions will change in the near future. So once again, we will enjoy what makes us all proud to live, work in this province, and that's our great outdoors. Individual New Brunswickers, each and every one of you, are the ones who have the power to make the difference. Even a few people letting down their guard can cause those numbers to skyrocket. Nous sommes une petite province, avec des chiffres.
We are a small province. With numbers like the ones we have, even if it's not you or a member of your family, it could be, and it will be, someone you know.
Trying times, and many of you are dealing with concerns about your work, your home, and your income. Among the many programs to assist people during this difficult time is the one-time $900 benefit we created for workers or self-employed people in New Brunswick who have lost their jobs due to COVID-19. This was set up to ensure people had money for essentials while we waited for the federal program to kick in. Since the federal program has been up and running since Monday, applications for the provincial benefit will close tonight at 8 p.m. For those needing assistance, you now need to apply for the federal program because the provincial program will no longer and is no longer required. If, however, you've already registered for the provincial benefit and have questions, do not call the Red Cross line today. These are people trying to get through who have not yet applied. The phone lines will be open for the next several days for existing applicants. This long weekend, when you're tempted to visit friends and family, remember the numbers we shared with you today. And remember the role you play in keeping those numbers as low as possible. By staying at home and practicing physical distancing now, you are making a difference. That doesn't mean Easter weekend has to be like any other weekend. Soyez créatifs.
Be creative. Start new traditions so that this weekend can be special. Stay in touch with your family and your friends by using social media, for instance. Or just call them to have a chat.
You can stay connected even when we must remain physically distant. This situation will not last forever. The steps we take today and in the days to come will help to determine how long these restrictive measures will stay in place. If possible, we want to keep this to weeks, not months. Together, we can keep our numbers low in New Brunswick. Stay home, stay safe, stop the spread. We need your help. Thank you. Merci.
Thank you. Merci beaucoup. We will now proceed with questions from the media. Each reporter will have one question. You're invited to ask your question in the language of your choice.
We will now move on to the media questions. Each journalist will have one question, and we encourage you to ask your question in the language of your choice.
Hi there, my question is for the Premier. This morning on Information Morning, you said you were already thinking about economic recovery, but that certain precautions would remain until a vaccine is found. Since people estimate that could be even up to 2 years away, can you elaborate on the precautions you expect to endure while you try to get the economy going again?
Well, I think it greatly depends on the situation we find in New Brunswick. You know, if we were able to continue this trend and we were able to then to have testing in different areas that allows us to ensure that we do not have people that are carrying the virus, then we can look at each business and we can say, okay, how can this one operate? How can it meet the social distancing requirements as required in the situation? And how can we allow a startup? We believe there's a balance here because, you know, if people don't have a job, if they don't have income, if they don't have a future that they see and a livelihood, they can become more stressed. We can have social situations that become unbearable, and we don't want to see that happen. So this is a balance. Right now, ONB are working on about 1,200 cases. We're interfacing with the federal government for the short term, like the 2, 3, 4 month time frame, but we're working with each business in order to ensure that they can restart, reestablish their business, and be there for the long haul. Because at the end of the day, that's what's going to be successful. So we'll judge each business in that regard, work with public health work with the Department of Health to ensure that, they can work and operate safely and start up in a process that allows that.
Thank you. Vicky Hogarth?
Thank you, Bruce. My question is actually for whoever feels they can best answer it. Now that you've projected a best and worst case scenario for the province, have you also developed an ethical framework for the very worst case scenarios around the allocation of resources for things like ventilators? And I say this because we don't have to look as far away as Italy for the worst case scenarios, because the tragedy of Bob Cajun is very painfully close to home.
So those ethical frameworks are being worked on with the RHAs currently, and so that is something that is being taken into account with their pandemic plan.
Thank you. Clara, Times and Transcript?
Premier, in other jurisdictions across the continent, we have seen the devastating effects of not stopping the spread fast enough among vulnerable populations. The minister said today he doesn't have any concerns with the number of tests available. So why is the province not taking widespread proactive testing for COVID-19 with vulnerable populations like the homeless, those in jails, the nursing homes, group homes, and those who work with them?
So that issue has been raised. I know that Dr. Russell and her team are looking at that, working with the pandemic task force to understand where let's say, more testing may be required for vulnerable populations. That is very much on the radar. Other possible areas that we could have concern, like critical areas that have been identified, will continue to be identified. So that is one group that I would dare say coming forward will be a recommendation of additional testing. But I leave that to public health.
Thank you. Andrew Waugh, Telegraph Journal.
Thanks, Bruce. I'd like to understand, has there been some sort of a change? Have you received new advice from the Privacy Commissioner? I mean, every time we've asked for details on people, we're told that we can't be given them because of privacy concerns. But now, Premier, you've revealed that this is a family, 3 members of the same family in the Fredericton region. Why are you providing details now that you didn't provide before?
So I think, as we have demonstrated right now how serious this is at this point in time in order not to provide or have spread. I wanted to be clear how easy it is to not only have your family impacted, but how easy it is then for that to spread into other members of the community. But in this case, it could, you could have one individual that felt like, well, it's not a problem, but then their whole family's impacted. So the point is, we are at a cusp here. We're at a stage where we'll either fix this, and I say fix it in the point we'll manage it. Our curve won't even begin, and we will look back on and say, well, aren't we glad we did what we did collectively? So sometimes it takes just a different process in order to get people's reaction or the reality to set in. And for me, it's how do we get reality to set in? Because this is a weekend that I want to change in a positive way, not a negative one.
And people need to realize that the place where this virus spreads the quickest is in the home. If you go home with that virus, you will undoubtedly, in all likelihood, infect everyone in that household. The virus spreads at a very, very contagious rate. A person infects between 3 and 4 people that a person comes in contact with. And when you go home, you're into an environment where you're using the same bathroom, the same kitchen, you're walking in the same hall, you're walking up and down the same stairs. So it is critical, and people need to realize that it's not about themselves. And the Premier illustrated that point because it was necessary. If you get this virus and you go home, you, in all likelihood, are going to give it to every member of your family. And people need to understand that.
Thank you. Monsieur Cameron, TVA Edmundston.
Oui, ma question s'adresse.
Hello, my question is for Premier Higgs. Last Tuesday, you announced the following, that the limit date to request emergency benefit for New Brunswick workers would be today, April 9th, at 8 p.m. So here is my question. have you brought the date forward? Because initially it was meant to be until the 30th of April. Have you brought the date forward because there were too many requests and maybe you weren't able to financially meet all these requests? Or is it simply because the federal benefit came in a bit quicker than was expected? Would it potentially be possible, would you consider maybe pushing back the date to put in a request for the New Brunswick benefit?
I think what needs to be clear here is why the benefit was put in place to begin with. It was very, very clearly stated that we were putting that in as a stopgap measure between when the federal program would roll out and the interim when people would lose their job and wouldn't have any income. So it was set up for a 2-week, that's why the $450 a week, the $900, to meet that requirement. The federal program started rolling out, I think it was on April 6th. So it is up and running, and we are told that the response is immediate. When people are applying, I mean, they're very quickly turned around with cash, with dollars. So I think we need to be very clear. It was set up as a gap measure so people would not be 2 weeks home without money. And that is exactly why we did it, and we did it for the time until the federal government got up and running. If the federal government wasn't up and running now, we would still be doing it, and we would keep on doing it because we were not going to allow people to sit home and worry about the financial well-being of their family and themselves.
Thank you. Merci beaucoup. Megan Yamoa, Global.
Thank you. Premier, I want to ask about the federal health transfers. The federal government says it withheld almost $150,000 because of your government's refusal to cover abortions outside of hospitals, but has now paid it out because of the pandemic. What is your reaction to them reducing the funding, and will you provide private abortion clinic funding to help reduce hospital visits during the pandemic?
I will start with that. The Minister of Health may want to complete and have an addition to this. Certainly, our position has been clear from the very beginning that we were not funding a private clinic in New Brunswick. We are meeting the Canada Health rules and the Canada Health Act, and we were providing the services necessary that we agreed and believe certainly were necessary and believed we were meeting the requirements. So that position hasn't changed, and that's kind of where we are. And Minister, if you'd like to add to that, then please do so.
Yeah, the Canada Health Act is a funding statute, and it has a dispute resolution. That resolution lies entirely with the federal government, and the position of the province is the consistent position of previous governments, and nothing yet has occurred from the federal government, and we believe that the procedure is not in violation of the Canada Health Act, and the ball is entirely in the federal government's court with respect to dispute resolution.
Thank you. Mike Cameron, CTV.
Thank you. I asked this question at the previous briefing, and I'd like to direct it toward the Premier, if that's possible. If the numbers, Premier, start to go in the wrong direction, if they start to trend in the wrong direction, the Minister said a few minutes ago that the government would do whatever it takes. I wonder if you could give us a specific. What is next? What is the next step for your government if the numbers start to trend in the wrong direction? What are you willing to do under the state of emergency right now to ramp up that state of emergency and the rules and regulations? What's your next step, sir?
Well, I think the point of, we've laid out rules and regulations and fines that are related to not following the Public Health Act. We've actually, increased the fine mechanism there to allow that to happen. We've gone through this analysis to say, could our health system manage it? Do we have to further lock down? Do we have to shut down other businesses in order to stop the spread and control the spread? I mean, those would be additional measures that would be taken. And I am hopeful, I'm optimistic that won't be required, because I do believe that people of New Brunswick are recognizing that we can beat this. We can be different, we can be leaders in North America, and in many countries we can be leaders right here in New Brunswick and set the stage and the bar really high for compliance, for diligent due diligence, and for recognition that if you have the willpower, you can make a difference. And I guess I have confidence that the people of New Brunswick are going to demonstrate that, and have thus far, and will this weekend.
Thank you. Geneviève Normand, Radio-Canada.
Hi there.
Radio Canada.
Good afternoon. My question is for Premier Blaine Higgs, and it's about Campobello Island. Because there are current concerns about the U.S.-Canada border. As you well know, they fully rely on the crossing of this border to access basic goods and services. So why not implementing a provincial permanent ferry to provide the islander access to New Brunswick?
We have an agreement with the U.S. and the state of Maine to continue the movement across the border, whether it be, going for the residents of Campobello to Lubec, Maine to get essentials, or whether they travel right through Maine and get back into St. Stephen. That is the process that has existed for generations and has worked very well. So at this stage, there isn't any restriction on the ability to do that. Now, will that change coming forward? I don't know. But right now, someone from Campobello could go directly through Maine, not stop, go right into Canada, and do as they've always done for years and years. So as long as that continues, then we will work with that as it's always been. And the ferry service, we're looking at that coming back in the spring. Maybe we can start it up a little earlier than normal, but we are looking at that possibility, and DTR are currently analyzing that.
Thank you. Merci, Geneviève. Kevin Bissett, Canadian Press.
Question for the Premier. Premier, you've talked about the importance of this weekend, and on a number of occasions mentioned about called ATV rallies that were planned. Have you managed to get those canceled, and are there any other events that you're keeping your eye on?
It's my understanding there isn't any ATV sanctioned rally by the Federation, and in fact I think that after I said that, they made it clear that they were not going to sanction any rallies. So that's great. I think other such groups are also doing the same thing in any outdoor activities. They're saying, we're postponing these. We're not going to have these gatherings as we once planned. So that's the goal. That's the incentive. So now what I'm saying is to individuals that maybe live in a community and there's 6 or 8 or 10 other people, and every time they get a chance, and this is a weekend, maybe one of the first for ATVs, that they say, well, let's all head out. Well, this isn't the weekend to head out. This is the weekend to just say, look, let's think about this. I'd rather go through, let's say, June and July, or July and August, and I don't want to miss that window and have us be further restricted. I want to be back to normal as soon as possible. And the only way to ensure getting back to normal as soon as possible is foregoing this weekend, maybe another couple weeks, maybe another month. But these next 2 weeks are critical. And all of the information that's presented by the Minister of Health, the Health Department, and Dr. Russell over this morning and this afternoon only indicates how precarious their situation is and how important it is for people in all groups to say this isn't the weekend for us to forget about the task at hand. And the task at hand is staying home and avoiding the spread and following all the rules that have been laid out by public health.
Thank you. Silas Brown, Global TV.
Hi, Premier. You mentioned just previously in that last answer, and a couple times over the last couple of days, that people need to take these measures seriously at the hope of being able to do things this summer. But some of what we heard from the federal government today is people really shouldn't be expecting that we'll be back to even business as usual by Canada Day, by July 1st. We shouldn't be looking at it that way, and even your modeling numbers are saying 1.5 to 2 years that we could be, dealing with waves without a vaccine. So, do you need to give New Brunswickers maybe a more realistic picture of how long we're going to be dealing with this, rather than saying, hey, look to the summer and get through this weekend, look to the summer?
I guess realistic could look in many different forms. And while, we've made it very clear about the ability for us to do something different, to have a better outcome than others, and the repercussions or the presenting these numbers and the fear that's generated. In many ways, I feel like, fear drives the right behavior in many situations, but hope provides the will and the determination to succeed. And what we're trying to do is balance that, because there is hope. There is hope that New Brunswick can return to normal in some fashion this summer. as it's been said and has been said by the minister earlier, hope won't be completely restored or our situation won't be completely changed until we have a vaccine. And that's currently being projected to be a year and a half or 2 years out. So what does a change in our daily life look like? It depends exactly on how we control this and exactly how we can minimize the spread and keep it isolated and keep it segregated and know where it is. And that'll make the difference for New Brunswick. So while the federal government, we know the situation Ontario's in, we know the situation that Quebec's in. So do I see anybody traveling to those provinces anytime soon? Not if they would like to certainly come back to New Brunswick and stay healthy, because that wouldn't be a prudent thing to do. But can we be different? Absolutely. And I think we're on that path. So I believe to choose a mixed process here. What'll change this summer? It won't be as normal, but it could be a whole lot different than it is right now.
Thank you. Michel Corriveau, Radio-Canada.
Bonjour, c'est une question.
Hello, my question is for Dr. Russell. It seems that the worst case scenario could be 5,600 deaths. Even with measures, there's a worst case scenario of 1,750 deaths. Do we have the necessary resources, the beds, the staff, the ventilators, masks for each of these worst case scenarios? Yes, this plan will be presented next week, I believe, with our network partners.
Anna, Telegraph Journal.
Hi, my question is for Dr. Russell. So, Shannix has told me that in their nursing and retirement homes, staff will now be required to wear a non-medical mask as they care for residents. Do you recommend that elder care homes require their staff to do this? And how can homes implement that measure, have their staff wear non-medical masks in a safe manner?
So as things evolve, our information and our guidance will change. So we just received new guidance documents from the Public Health Agency of Canada. We're comparing that to the guidance documents we've already presented to social development. So again, this is an evolving situation, and right now, because we know nursing homes and special care homes, et cetera, are more vulnerable in terms of the risk to that population. If they're recommending to wear facial masks, non-medical ones, that is about protecting the patients from contracting the illness from the healthcare workers in those facilities. So that would be the reasoning behind that.
Thank you. Simon Delac, l'Acadie Nouvelle. Simon? Vicky Hogarth, Charlotte County TV.
Are we doing second questions? I've had one. I do have another one.
Oh, my apologies. I don't have my glasses on today. Danielle McCready, CBC.
Hi there, my question is for the Premier. Because you are so worried about people violating physical distancing rules over the holiday, what has the government told police forces around the province what they should be looking for over the Easter weekend, and where and how tough they should go about enforcement?
So am I worried? I'm more concerned than I am worried. I believe that the citizens of the province will surprise us all in their appropriate behavior this weekend. So that's what I feel very optimistic about. Do we have the authority, do the officers, both the RCMP, the police officers, the safety officers have the ability to enforce behavior that does not respect our Emergency Measures Acts and the public health requirements? Yes, they do. Will they proceed with that enforcement? I'm hoping it won't be necessary, but if it is, yes, they will. It is a situation that we must adhere to the rules for our own health and safety.
Voici la fin de
This concludes today's update. Thank you, everyone.
today's update. Thank you.